A couple of my friends have gone to physicians' offices only to have a staff member tell them that we cannot serve you and, we would like you to leave.
Just basic health care that we all take for granted in society is often denied to members of the transgender community. The medical care that we need is backed up as medically necessary by the American Medical Association, the Psychiatric Association, Psychological Association, yet insurance doesn't cover them in many cases.
There are a very few number of providers that are really well-versed in mental health care for trans people.
41% of the transgender population have attempted suicide. If we're struggling socially and struggling professionally, the therapy is very important.
It's hard to find providers who have had any formal training. Most of the providers that I've ever worked with develop their expertise because they've had a desire to work with our community. When I went in for one of my surgeries, my mental health care provider at the time actually flew to California with me and sat with me, went to the hospital with me, so they would know better what a trans person goes through when they have to travel out of state to get medical care.
We need the care for the way our bodies physically are, and that can vary greatly between all of us depending on what kind of medical services we have had during our transition. So the acceptance and the coverage by insurance needs to be broad enough to be able to take care of every one of us, no matter who we are and no matter what path in life we are.
There's really no reason why a person's standard of care and quality of life should be dictated by their gender identity.